Okie dokie. Alrighty. Good evening, everyone. Good evening, good evening. I think we should be going live here shortly. Hopefully YouTube will kick in here. Good evening, everyone on Facebook. Hello, hello, hello. Okay, I'm Dr. Randall Gates, board certified chiropractic neurologist. Also a chiropractic physician at Gates Brain Health. Tonight I'm talking about understanding panic attacks. I'm rushing to get this broadcast on time, so forgive me if I'm breathing hard. Nonetheless, panic attacks are very serious, and hopefully you enjoy the presentation. Send me any of your questions. I will answer them if I can. Okay. I'm going to present from the beginning. Take a drink. And hello to everyone who's joining. All right. So, understanding panic attacks. This is a great article if you want to look at it. It's pretty in-depth. They really cover many aspects of panic attacks. It's from Neuroscience Behavioral Revolutions, 2014. Etiology, triggers, and neurochemical circuits associated with unexpected, expected, and laboratory-induced panic attacks. And so with panic attacks, I may as well just get into that. What are they? So panic attacks are basically recurrent, and if they're recurrent, they equate to panic disorder. If they just kind of happen once or a few times, then we're just going to call it panic attack. So basically, if it's happening all the time, it's going to be panic disorder. Panic attacks are part of panic disorder. Or you can just have isolated panic attacks. These panic attacks can be heavily related to post-traumatic stress disorder and other phobias. And so there's even a lot of research coming out right now about this current viral infection affecting the world and how panic disorder and panic attacks are going up markedly because of that. Basically, within the panic attack world, we have these unexpected panic attacks, which account for about 40% of the overall totality of these panic attacks versus the expected ones. The expected ones may be in a situation where someone had an unexpected panic attack before. So, for example, let's say you had a panic attack when you went and saw your in-laws. That was unexpected. Whereas in the future, when you're going to visit your in-laws, you may have this expected panic attack. You get into that situation, there's familiarity, you thought it might happen, and then it does happen. And then there are also the laboratory-induced panic attacks as well. Panic attacks can lead to agoraphobia, i.e. in this example. So people tend to isolate themselves, they're afraid of social situations, they don't want to go out, they want to stay at home. Panic attacks are really common, actually. We're talking like 7 to 10% of the population. Some estimates think that they account for like 20% of the emergency room visits. I've seen other estimates state that they are the most common cause of people going to the emergency room who are otherwise kind of in the younger age demographics and appearing healthy. And 2 to 5% of the population has panic disorder. So pretty common. And hey to everyone who joined. Awesome. A huge element of panic attacks is this fear of dying or a fear of losing control, heart palpitations, hot flashes, hyperventilation, paresthesias, which are numbness and tingling, dizziness and nausea. So if you take an otherwise seemingly healthy person, and let's say you're 20, maybe you're 30, maybe you're 40, in your 40s, and you have this situation where suddenly it comes on where your heart is racing, you're feeling heart palpitations, you have this impending doom feeling, like something bad is happening, like you're going to die, you're going to lose control, and then you're starting to go numb, maybe your hands are starting to cramp, and you're dizzy and you're nauseous. It's a really frightening situation. I think everyone can get that, and that is the reason why people go to the emergency room, rightfully so, because you want to rule out a heart attack, that you need to go to the ER if you're having those symptoms. But once they rule everything out, then lots of times they'll say, okay, you're having panic attacks and you need to follow up with your general practitioner. Of course, we have to talk about the diagnostic criteria. The DSM-5 now says that basically you have to have 4 out of 13. 2 need to be cognitive, and basically 2 need to be out of the 11 physical symptoms. So I have those listed down here at the bottom. So again, palpitations, diaphoresis. Diaphoresis is where you're sweating, trembling, shortness of breath, choking, chest pain or chest discomfort, nausea and abdominal problems, dizziness, derealization or depersonalization. And that's common with anxiety disorders where you're not getting enough blood to your brain, so one starts to feel like they're not in their body, fear of losing control, fear of dying, paresthesias, chills, or hot feelings. So I think you probably get it at this point. Most of the time, panic attacks peak within 10 minutes, and they last around a half hour. They may occur again in calm periods or in anxiety-ridden periods. So again, they may just happen haphazardly. They may then happen, in a situation similar to what occurred haphazardly, which then creates an anxiety-ridden event. They also can occur at night, and I'll show you an article that I attached. The nighttime ones can be really difficult because it creates a significant fear of sleep. So individuals are afraid of going to sleep for fear that they're going to have a nocturnal panic attack. And then relative to those nocturnal panic attacks, this was a great article where they said intolerance of uncertainty and responsibility for harm predict nocturnal panic attacks. And basically here they were saying, if there's a lot of uncertainty in a situation, you don't know how a custody hearing is going to go. Let me see here. Oh, okay. Oh, wonderful. So let's say maybe you have a custody hearing for a child and you don't know how it's going to go, or you're going to a divorce hearing and you don't know how it's going to go, or you're going in for your annual review with your job with your boss and you're uncertain. Those can be situations that provoke this uncertainty, as well as the responsibility for harm. There's just the responsibility that seems to go with increasing decades, particularly the third and fourth decade, seem to be associated with these panic attacks. Air pollution, surprisingly, is associated with panic attacks. So here on the West Coast of the United States, we had horrible wildfires this year, horrible air quality. I mean, just atrocious for, I don't know, you guys can chime in, but I think it was at least like almost 2 months. We had like gray days, and even if it wasn't gray, then the particulate matter was smaller on those days. So air quality was very low. It affected my patients. It affected the health of a lot of people. A lot of people were struggling, and if you live in an urban environment where there's a lot of smog, air pollution is actually significantly associated with panic attacks. Tobacco, alcohol, and discrimination. So this article was done on, I can't remember which minority group it was, but they basically showed that tobacco is associated with panic attacks, alcohol is. Those may not be surprising, those two, but discrimination also. So things to keep in mind for all of us regarding what's going on in our society. And then in terms of causation, there's basically a genetic association with panic attacks. I think it's around 30 to 40% for monozygotic twins. So, for example, like schizophrenia has a 50% heritability between monozygotic twins. And then basically for panic attacks, it's 30 to 40%. So that's pretty high, really. And then I think it's like 10% for offspring. So if your parents had panic attacks, you have a 10% chance of developing panic attacks. So that's all important to be aware of. And then there's a lot of discussion on hormones, because panic attacks seem to start occurring when hormones increase, when we're in adolescence, and then it keeps going into our 20s. And maybe the stressors of life add up as we go into our 30s and 40s, and some of those unexpected fears that I mentioned. Now this is I brushed over this. So as I oftentimes talk about, I like to talk about the neurobiological substrate of these conditions. So what is going on in the brain? Simply, if you think back to when people started saying right brain, left brain, The whole right brain, left brain thing came from Roger Sperry. He was a Nobel Prize laureate, I believe, in physics. He started driving around the country in the 60s in a van studying basically epileptic patients whom at that time they would basically cut their corpus callosum in half so that the two hemispheres were not connected. So we had all these quote-unquote split brain subjects. And he would do things, you probably have heard me talk about this before, but he'd do things where he would put a pen in their left hand and he'd say, "What is this?" And they'd say, "I don't know." And then he'd say, "What is it used for?" And they would say, "It's used for writing." And then he would do, literally a few moments later, put a pen in their right hand. He'd say, "What is it?" And they'd say, "It's a pen." And he'd say, "What is it used for?" And they'd say, "I have no idea." So from that, he gleaned how there are different functions in different hemispheres of the brain. Some of what he's found, David Gazzaniga, I think is his name, who was at UC Davis, who was his protege, has used functional MRI studies to validate a lot of what Dr. Sperry discovered. There's also a lot of new information that basically shows our brain is really connected on both sides, but there can be some laterality. So in essence, the fear response seems to be stronger in the right hemisphere of the brain, or the right hemisphere of the brain has stronger connections to what is termed your sympathetic nervous system. So in this article, they found reduced temporal volumes. So your temporal lobes involve your hippocampus and your amygdala. Your temporal volumes can be reduced in panic disorder, as well as a right frontal lobe volume. So that's interesting. The right frontal lobe is going to dampen down that right amygdala. So there's potentiality that something abnormal is going on, either developmentally or throughout a person's lifespan, that cause that right frontal lobe to be smaller. This is a really great article. It's out of Clinical Psychopharmacology and Neuroscience, just published this year. I think it's pretty recent. I'm not sure what month. Basically, they said higher rightward laterality of the hippocampal tail. So the hippocampus, again, is your memory area. It's deep in the temporal lobes. So this is a section through the brain. The temporal lobes, where the hippocampus and amygdala are way deep in here. And they found this hippocampus kind of looks like a tail, so to speak. Higher rightward laterality of the hippocampal tail and its association with early trauma and panic disorder. So this is a phenomenal article because the authors basically say a lot of people with panic disorder have a history of childhood trauma. Again, something to be attentive to. We'll just say as a side note, childhood trauma seems to underlie a lot, but not all, of a lot of these conditions that we then put labels on later in life. It affects irritable bowel syndrome, fibromyalgia, chronic fatigue syndrome, depression, anxiety. Certainly it can be tied in with post-traumatic stress disorder, tied to those early events, and panic disorder. So basically, what they found in this article is that they talk about how as your hippocampus develops, let's say it this way, when you're a child, the back part of your hippocampus tends to be really strong and the front part of your hippocampus may not be as strong. And they saw in these individuals exposed to childhood trauma that the back half of the hippocampus, which was going to be affected by early life circumstances, in essence had a rightward laterality, and it had a different volume from those who were not exposed to these childhood trauma events. And if I remember correctly, the right hippocampus and the posterior aspect of the tail was enlarged. So frequently you'll hear me mention like the hippocampus is small in depression and the amygdala is big in depression. That's the general consensus for most studies, is that we have an enlarged hyperactive amygdala for depression, a small hippocampus, which sets into motion the physiology of depression, leading to high stress hormones, which then feed back and negatively affect the brain, causing synapses to, for all intents and purposes, wither in the frontal lobes and this hippocampus to shrink. The reality of other anxiety disorders is that there seem to be changes, but it's not always as simple as that. There's different subregions of your amygdala. There are different subregions of your hippocampus that can be affected. But this is a fantastic article that really summarizes the data on this matter, to date. This is 2020, a 2020 publication, and here they're just showing features of what they found in the laterality of the hippocampus. So, takeaway points. Oh, and also the mainstream medical treatment seems to be SSRIs at this point in time, which are the serotonin-specific reuptake inhibitors, like I talked about last night. So, takeaway points are that panic attacks can be unexpected or expected. Unfortunately, the expected ones tend to occur in environments where unexpected panic attacks have once occurred. Panic attacks are very real. They're very common, like 10% of the population can have panic attacks at any given time. They're probably going to land somebody in the emergency room. And factors to be aware of are certainly genetic associations. Other factors include air pollution, as well as tobacco and alcohol use, whether somebody's being discriminated against in their daily life or their environment, things to be aware of. Also, interoception, which I didn't mention, tends to be really heightened in those with panic attacks. So interoception refers to an awareness of our internal bodily sensations. So those, I believe it's with unexpected panic attacks particularly, have really heightened interoception. So they may feel something excessively internally, which can then set into motion a panic attack. And then we have the element of childhood trauma that may apply to you, it may not. And if it does apply, then know that the trauma that happened earlier in life may have affected brain development, particularly of the posterior aspect of the hippocampus, which seems to be enlarged in the right side of the brain. And they think that enlargement of the right posterior laterality of the hippocampus ties in with the painful memories of the childhood trauma. I didn't mention that before, but that's what they're thinking. So the painful childhood trauma memories seem to kind of get facilitated into that right hippocampus. And again, it seems that the right side of the brain generally has more connections to the fear system, but that is just, it seems to, it's not, as though the left side of the brain doesn't have effect on anxiety. So, and then the mainstream medical treatment includes SSRIs or other medications to calm down the anxiety responses. Functionally, what we do at Gates Brain Health, we work with patients naturally. So we work with promoting neurogenesis. That's an aim of a lot of our treatments, using natural protocols as well as referrals, because you may be having panic attacks and you may need to see a hypnotherapist. I found that certain hypnotherapists can be like miracle workers with my patients. And so maybe there's some aspect of childhood trauma that needs to be worked through from a subconscious perspective. Maybe you need to see a psychotherapist, someone who's really good, who can help you with those issues, because certainly that may help too. And just calming down some of the cognitive aspects of these stress-based symptoms, whether, like I cited in that one article, maybe something unexpected is happening, or maybe it ties in with childhood trauma. So these things can be certainly of value. There we go. I think I covered that. Are they all brought on by triggers or for an unknown reason? So the unexpected ones are for an unknown reason, but they can be brought on by triggers. Okay. Yep. And then, the current climate of what's going on certainly can affect the global stress levels. We had someone comment, where are these articles? I'm doing a live on YouTube, so you can access these articles on YouTube. It will be posted. You can watch it right now, but once I end the broadcast, it'll probably be on YouTube within 30 minutes. And let me see here. Okay. And I think that pretty well covers it. So I'll go through the rest of the comments here in a second, but without keeping everybody waiting any longer, I'll sign off. Have a great Wednesday night, everyone, and hope to see you soon. Stay safe, stay well, and I'll probably be back tomorrow with some sort of broadcast. Okay.